Good morning. What a pleasure and delight it is to be here with you this morning to talk about global advocacy. I'm Liz Thompson, as Dr. Anderson said, and I'm the Senior Vice President responsible for global public, medical, and scientific affairs at Susan G. Komen for the Cure. And as you can see, I'm going to talk a little bit about advocacy for impact. So framing that, what is advocacy? Many of you in this room, probably all of you in this room, are advocates. You're activists for change. You may or may not identify yourself as that person, but if you really look at this definition, that they're individuals or groups aimed to influence public policy, resource allocation decisions within political, economic, and social systems and institutions, and that it's motivated by moral, ethical, or faith principles, or simply to protect an asset of interest. In this particular case, we're all gathered together here today, of course, to talk about our collective interest in better breast health for women around the world. And as we move through the next 15 minutes, what I'm going to talk about, I'm going to give you a framework for the work of Susan G. Komen for the Cure on the global level, and then talk about 3 regional snapshots. And I apologize, I know that we have many grantees and partners and collaborators from many parts of the world here. In 15 minutes, we simply weren't able to go through all of that, and I'm not really able to go in depth in any one of these. But we'll kind of move through the work that we've done in Bosnia and Herzegovina, Egypt, and then in Latin America, a very quick snapshot of Brazil, Mexico, and Costa Rica. So who are we, Susan G. Komen for the Cure? This fall, we will be celebrating our 30th anniversary. We were founded by Ambassador Nancy Brinker, again, 30 years ago, and we'd love for you to come to the Kennedy Center in Washington, D.C. and celebrate that auspicious anniversary with us. We were founded for women and by women. Today, we are the world's largest grassroots network of breast cancer survivors and activists. Last year, 1.5 million people participated in a race for the cure. Last year, 1 million people a month came to the Susan G. Komen for the Cure website to learn about breast cancer education and information. Our organization was founded on a very simple promise: from one sister to another, to save lives and end breast cancer forever. And to do that, today we've invested more than $1.5 billion, with a B, since our beginning, in research, community health and education programs, and public policy all across the world. And as we move through this talk, I'll be talking about how we've invested those dollars in those communities to move advocacy efforts forward. Why are we doing what we're doing? As you know, you've been here. This is the 3rd day of this phenomenal conference. We are facing a global breast cancer crisis. And as we move forward in the next 25 years, we're facing what Ambassador Brinker calls a cancer tsunami. Approximately 25 million people are expected to be diagnosed, and 11 million people will die. This, of course, is going to be hardest hit in our lowest, in the countries with low economic resources and middle economic resources. We're gathered here today to find those solutions and implement those in our country. And often that's on the backbone, certainly of science and research, but advocates and public policy people who can get things done and unleash the resources from the Ministry of Health and others to make that work possible. What has our approach been? Listen, learn, and support. Our partners tell us on the ground that this approach is collaborative, impactful, responsible, and innovative. There we go. We work both at the grassroots and the grass tops level. And many of you have familiarity and lead these efforts in your own country, so I won't go through all of the people who participate, but you know that combining these works is an essential part of a successful advocacy program. Where do we work? So as you can see, if Ambassador Brinker were here today, she would tell you that she is not going to stop until we have pinked the world, pinked the globe, and even then we won't be done. We won't be done until we've moved forward with the cure. Today, we have relationships and we've funded programs in 50 countries around the globe. We're currently active in 25 countries. When we say we're active, that means that we've created research investments on the ground. We've created community partnerships and collaborations through our Course for the Cure, through our Race for the Cure, and through incredible partnerships on the ground with organizations on the for-profit side, such as Samsung, on the not-for-profit side, such as the Jewish Joint Distribution Committee, the IIE, the Institute of International Education, and many others. And as we move forward, we'll talk about that a little bit more in detail. The Course for the Cure in many places is the foundation for us in terms of advocacy training and program development. It has two basic tenets. First, we learn to build capacity in those regions and in that country, and then we move into putting those ideas into action. So in the core modules, we gather people together from the region. Again, we know that these are people who are survivors, breast health educators, physicians, nurses, people who are really interested in that. And we try to understand what are the most important things for this community. Because again, they have limited resources. As a grantor, we have specific resources, and marrying those together, we have to figure out how we're going to start with the priority actions. So we do an assessment of the community. Almost all of the work that we do is focused on awareness and education. So as Dr. Anderson said so well in his presentation just a few minutes ago, we can do all the best work in the world, we can create the best models, but if we don't educate and create awareness, women won't come to the programs, they won't come to the centers to be treated. Finally, we develop advocacy programs so that we can continue that grassroots and that grass tops program. Fundraising is an essential part of every one of these programs. As a grantor, when we come and collaborate with countries to develop them in country, we obviously are making an investment. But one of the reasons that we teach basic fundraising skills is because we can't be there forever. Most of the investments we make are long-term. We don't just come in, make one investment, and get out. But we want these to be sustainable. So we teach the people in our programs how to develop microfinance and fundraising programs to build them and grow them. And finally, volunteerism. So if I have a candle and I light your candle and we light all the candles in the room, we'll light up the hearts and the energies, the time and talent to continue to build these programs. And then we move into, after we've built that basic capacity, 4 key steps. The community needs identification. Once we've done that, we create an RFA. What kinds of grants do we want to make in that community? And then we make the grants, project implementation, monitoring, and evaluation.